Many times in our practice, we do come across well appearing febrile young infants, and we are in dilemma whether to admit the child or not, whether to do lumbar puncture or not, and start IV antibiotics or not. The Pediatric Emergency Care Applied Research Network derived and validated a clinical prediction rule from a prospective cohort of over 1820 well appearing febrile infants younger than 60 days of age. Hello friends, welcome to channel Thinkpedia. In this video, recently published article in JAMA 2019 April is discussed, which can help in our day-to-day practice. Multiple approaches have been developed to identify serious bacterial illness in well-appearing febrile young infants to avoid the potential harms of unnecessary antibiotics and hospitalization. In young febrile infants, serious bacterial infections including urinary tract infections, bacteremia and meningitis may lead to dangerous complications. However, lumbar puncture and hospitalization involve risk and costs. Clinical prediction rule using biomarkers beyond the white cell count may accurately identify febrile infants at low risk of severe bacterial infections. So objective of this trial was to derive and validate a prediction rule to identify febrile infants 60 days and younger at low risk of serious bacterial illness. It was a prospective observational study conducted between March 2011 to May 2013 at 26 emergencies departments. Main outcome and measures: serious bacterial infections defined as urinary tract infection, bacteremia or bacterial meningitis. So result of this study or the trial was that derived the prediction rule on a random sample of 908 infants and validated it on 913 infants. Serious bacterial infections were present in 170 of the 1821 infants, including 26 with bacteremia, 151 with urinary tract infection, and 10 with bacterial meningitis. The prediction rule identified infants at low risk of SBI using a negative urinary result, an absolute neutrophil count of less than around 4,000 or less, and serum procalcitonin of less than 1.7 nanogram per ml. In the validation cohort, the rule sensitivity was 97.7, but the important point to note that negative predictive value was 99.6%. One infant with bacteremia and two infants with urinary tract infections were misclassified, and no patients with bacterial meningitis were missed by the rule. To conclude, they derived and validated an accurate prediction rule to identify febrile infants 60 days and younger at low risk of serious bacterial illnesses using three investigations: number 1, urine analysis; number 2, absolute neutrophil count; and third is procalcitonin levels. Once further validated on an independent cohort, clinical application of the rule has the potential to decrease the unnecessary lumbar puncture, antibiotic administration, and hospitalization. So this was in brief about the article which was recently published. Thank you very much for watching this video. If you are new, consider subscribing to channel Thinkpedia for more videos related to the field of pediatrics, pediatric ICU, pediatric nursing as well as parenting. Thank you very much.